Welcome to this month's Fit for Colorado Talk to the Doc chat. I'm CBS 4 anchor and health reporter Kathy Walsh. For the next half hour, we'll be chatting about fitness and health issues here on CBS4Denver.com. It's something we're doing on the first Tuesday of every month at 11 a.m. Throughout this chat, we encourage you to ask questions by simply typing them in the chat window at right, and we'll do our best to answer those questions. In today's chat, we're going to discuss pregnancy. In particular, what steps you can take to have a healthy pregnancy. If you decide to have a baby, one of the most important things you can do is take care of yourself. And joining me today is Dr. Steve Grover, an obstetrician and gynecologist from Sky Ridge Medical Center, and Kim Gorman, Weight Management Program Director of the Center for Human Nutrition, UC Denver. Okay, doctor, let's start with age. Everybody wants to know, how old is too old to have a baby?
Well, what we're finding is that childbirth is occurring increasingly at a later age for our patients. And in fact, lately, we're finding that at Sky Ridge, more than 2/3 of our moms are over the age of 30 by the time they have their first baby, and about 1/3 over the age of 35. So there's not really a hard and fast cutoff, but after age 35, we do consider those patients what's called advanced maternal age, and that is considered high risk, but we feel like we can manage those risks. And I even had a patient a year or two ago who was 44 and had just a great healthy pregnancy. Everything went really well. So I think it depends on the individual and their health status.
Okay. You decide, all right, I'm going to take the plunge. I want to get pregnant. I decided I want to have a baby. It's right for my lifestyle at this point. What's the very first thing you do? Go have a physical?
I think that's really important. We call it the preconception visit. And so what we do is we have the patient come in. Of course, we do physical examination, make sure the patient's up to date on pap smear and mammogram if appropriate. And then we try to look at the individual's health. Does she have high blood pressure, or is she at risk for diabetes, things like that. We also look at the immunization record of the patient, because there are certain immunizations that can't be done in pregnancy that need to be done in advance. And so we'll want to check and make sure that the patient is immune to German measles or rubella,
right,
and get that immunization done prior to the pregnancy. We also want to look at risk factors, for example, smoking. If the patient's a smoker, we want to have her stop smoking before the pregnancy.
What's the problem with smoking? You know, when my mother was having children, she didn't smoke, but I knew people around me who did. You know, there were people who smoked all through their pregnancies. Why is smoking so bad? What have we learned?
Well, what we've learned is that the infant mortality rate in our country is 40% higher in smokers than in non-smokers. And the reason for this is it seems to affect the circulation in the placenta. The substances in the cigarette smoke act as vasoconstrictors, and so they constrict the vessels in the placenta, and then the baby's not getting the same amount of oxygen and nourishment from the placenta. And so it makes for smaller babies. And then there's also a greater risk for sudden infant death syndrome, or SIDS, in smokers.
Okay.
So both those that smoke during the pregnancy and those that smoke even after delivery, that can increase the risk of sudden infant death syndrome.
Wow. All right, Kim, everybody thinks, okay, I'm going to have a baby. I know I'm going to gain weight, but through this pregnancy, how do I eat? What do I need to have in my diet to ensure that I have a healthy baby?
Sure. And I think, you know, after you have that first visit with your physician and you're kind of, this is the pattern that or the set that we want to take and try to get pregnant, is I look at that as a training period. That's the opportunity to get your body's stores as full as you possibly can, get your body as healthy as you possibly can, meaning through physical activity and eating a nice healthy diet. If you're not getting your 5 food groups in a day, you're not hitting your 5 fruits and vegetables a day, you're not hitting your dairy consumption or calcium consumption, you want to really pay close attention. So in particular, we look at the calcium, we look at the iron, and we look at the folic acid before you get pregnant.
Okay, and do you find all of those things in food, or do you need to take a supplement?
We do recommend a supplement of folic acid, and there's a couple reasons for that. It could even be just the amount that's in a normal vitamin, just like a one-a-day type vitamin. It doesn't have to be anything in particular. In fact, it doesn't even need to be a prenatal vitamin prior to the pregnancy. But what is recommended is a minimum of 0.4 milligrams of folic acid. One reason we recommend this is because if there's not enough folic acid in the system, there can be a higher chance of neural tube defects, like spina bifida, where the tissues over the spine don't close properly. And so this is a birth defect that can be prevented with nutrition. And then the other thing is we've even found that the risk of Down syndrome is a little lower when there's folic acid in the system.
So as you mentioned, kind of like a one-a-day, if you take a one-a-day or a Centrum one-a-day is a great baseline for you pre-pregnancy, as well as making sure you're eating some whole grains. The FDA has required that when we fortify these grain products, that they have at least 20% of the RDI, what we need for folic acid, which is 0.4 milligrams.
All right. So, Kim, let me ask you, you know, a lot of people say, I want to get pregnant, but I want to wait, I need to lose some weight. Is there if you have, say, 10 extra pounds, 15 extra pounds, should you lose that before you get pregnant?
You know, it depends on the person. Dieters can go about it in an extreme manner, and then, of course, would compromise where your stores are, where your nutrient stores are. So it's better to take whatever change you want to make. Look at maybe the biggest items. Are you drinking regular sodas, or you have lots of sugar beverages coming in? That would be something you want to take a look at, and how could we substitute those calories for something that's going to offer some nutrition? Potentially, you're going to have some dairy that enters into your diet, or maybe you're going to add some cheese to your diet to kind of replace empty, miscellaneous, non-nutritive calories. So look at some of the big items that you might be doing. Make a small change in that regard.
Yeah, doctor, do you ever tell patients, you know what, I really suggest you lose weight before you get pregnant?
I certainly encourage that. And there's one other thing that's kind of new with regard to nutrition, and that is, it used to be we'd just tell our patients once they were pregnant just to take a prenatal vitamin. Mm-hmm. But now there's been research that suggests that if you take omega-3, which is this little clear
and that's
capsule
the fish
here,
oil everybody
that's right,
about,
either
right?
fish oil or it's also in flaxseed oil.
Okay.
But if you take that along with the prenatal vitamin, then that can help with the baby's brain and eye development. And there's also been some studies that have suggested that there's less postpartum depression after delivery if you take the omega-3. So a lot of the prenatal vitamin companies are now including the omega-3 as part of the prenatal vitamin.
Kathy, let me show you, because I brought kind of the food version here, and you'll see right on here the omega-3s.
Right.
One of my favorite cereals all the way through my 3 pregnancies is Total. It's Total Raisin Bran. This is a new one that's out there.